Thank you so much. I appreciate it. And good afternoon to everyone, or good morning, depending on where you are in the United States today. I really want to start by just thanking Redox for taking the opportunity to bring us together, as well as all the presenters and most importantly, the frontline healthcare personnel. I'll give you a 10-second overview of myself. I'm a family physician. I am practicing in the midst of this pandemic, and really have a lot of sympathy, especially for those who are doing this full time, in and out, day in and day out. So at Bravado, we are a health IT organization and have a product called Ayva that is a patient engagement solution. And like everyone else here, we were trying to figure out what is it that we can do quickly to make an impact on the healthcare system right now. It's the pressure is immense. Everything you're reading is as true as it could be, if not sometimes even worse, from some of the colleagues that I have talked to. So we really are focusing this around what is it going to take to keep patients home for a couple of reasons. The first one is that we really want to have patients who do not need to be in the clinics or in the emergency departments exposed to other people who may have the coronavirus. Secondly, and it is absolutely the truth, the anxiety of healthcare providers going forward with insufficient amounts of masks. You'll hear stories over and over again. I could relay my own stories of having to reuse masks over the past couple of weeks within the clinic. It's really uncharted territory, and we want to make sure that if we're keeping patients who don't need to be in the clinics home, we're able to actually save those protective garments for the other patients who we do need to wear them for. So we actually are going to talk to you about two different types of solutions here today that address this pandemic. One of them is to actually talk about what can we do for patients who are under investigation or confirmed positives for the coronavirus that we want to keep track of. So that's the first one, and we'll go into some details about how that works. But the other one, and as a family physician, this is really our bread and butter. We are pushing patients back 3 full months, and they become the collateral damage. And the number of patients who are being pushed back is actually going to far exceed the number of patients who have the coronavirus, who probably will even get it. So what we're told is a non-urgent visit can be pushed off 3 months. Well, we all know that in chronic conditions, non-urgent can change in much less than 3 months. So the question comes is, who will care? Who's watching these patients while we're all focused on the coronavirus and the COVID-19 patients? So we want to make sure we have solutions to balance out both parts of this equation and help everybody that's impacted by this, because it does go beyond the coronavirus, the COVID-19 patients. So we really need to find out, though, what is that balance between bringing the patients in and then at the same time making sure we get the other ones who do not need the care to stay home. So I want to talk to you a little bit about the way our solution works. The first thing is it has to be simple. The system right now cannot tolerate any more disruption, any more burden. And I think Nico put it great at the beginning, or I forget who said it, but it was stated that we really need to make sure that anything we do is going to be streamlined and something that patients can stand up in a very short amount of time with very limited amounts of data. So where we are right now is we actually have a system that can stand up with no integration, with a batch upload of integration, or with a full-fledged EMR integration, and we can step our way through that. That's on the clinician side. On the patient side, we actually wanted to make this as easy as possible to bring patients up. The thing we're going to see is we're going to use an SMS to mobile web experience, nothing to download for the patients at all. All we need is a few basic pieces of information from them, their date of birth, their name, and their cell phone number, and we can start to get these patients enrolled. And you'll see here they'll get a link in step 1. They confirm their birthday. They make up a PIN at this point, and then they are completed as to what they need to do to enroll. And that's all it takes for a patient to be enrolled on our end. And as I mentioned, on the hospital side or the provider side or the health department side, it can be done by manually adding them, uploading a batch of patients, or a direct integration with the electronic health record. So what is the benefit of all this going to be to our healthcare providers? Well, we cannot be managing this pandemic and also be reaching out to patients who need to be reached out to when we don't know who those patients are. We can't reach out to all of our 3,000 patients on our panels every day or every week even and say, how are you doing? So we brought it into a single care coordination dashboard that if you were to enroll a patient in one of our engagement plans, and that's our proprietary word, or the words we're calling them, you will see a list of all the patients. And as they answer questions, those questions come back into the dashboard in the form of alerts. So you will know, I've just sent this out to 100 patients, and 5 of those are the ones I need to look at. Let this be automated. Take that burden off of the healthcare provider. So what does this look like? What are we trying to do for the direct COVID patients? So a patient who has COVID-19 confirmed or potentially is a person under investigation, there's going to be certain questions that need to be asked. We saw this a lot about 2 weeks ago when we were still in the attempted containment phase. And again, Nico's slides at the beginning were great, so I won't reiterate, but we had this phase of trying to contain it, and we've realized that is not going to happen. There will be community spread. We've moved into a large United States quarantine phase. So we're actually not reaching out as much to patients because everybody's quarantined. But this is going to become a huge burden in a couple of weeks or maybe a couple of months at the longest whenever we move to the mitigation phase. And the mitigation phase is saying, let's let people back in, but we need to meticulously track the patients who are under investigation, those persons who may have had contact, who may be developing symptoms, or who are confirmed. And so I'll demonstrate to you how this would work. How would we have Ayva reach out to the patients instead of a healthcare provider? So this is what the patient would see. Again, it's as simple as those few enrollment stages. You gave us the name, the date of birth, and the cell phone number. They're going to get a little welcome message each morning, or however you choose to configure it. Maybe it's every other day. And then we're going to share how we're feeling. Do you feel better than yesterday, same as yesterday, or worse? If the patient is feeling worse, an alert can be sent back to the dashboard, so we have an idea of how these patients are progressing over time. Describe my breathing. Breathing is a shortness of breath is a huge issue when it comes to the coronavirus. And we're using the modified MRC, which is a validated scale, asks a few questions in a more patient-friendly way of saying, how's your breathing, instead of 1 to 5, giving them some examples through this validated scale. And I'll go on. We ask the temperature, give them a little bit of guidance. If that 102.5 temperature was recorded, again, an alert can be sent back to the dashboard, and we start to see who are the patients with trouble breathing, who are the patients with temperature. Finally, we wrap up with some of the CDC's guidelines here, a little bit of information for them, let them know that we're going to check back in with them again today. So that is for the COVID-19 patients. It's really taking resources away that do not need to be there. Anytime we spend calling a patient, asking them what their temperature was, that is something a computer can do. A computer can do well. A computer can do at scale through this nice, easy to use, user-friendly format that we've developed, or we believe we have. Now let's talk about the other patients, because this is an avalanche that is going to come crashing down at some point. And it's not talked about as much as we've talked about the others. What about the rest of the patients? We've pushed them off. Our policy as the United States is to have pushed them off and got away from non-urgent visits. So who's watching them? At this point, it's largely no one, or maybe we're waiting for them to reach out to us. So same technology can be used. We can screen patients for their vitals and a health status. And the way we do that is, you saw the vital signs already on the COVID patients, but we can also add weight or blood pressure or some other things that we may need to know for a different population of patients. And then we use the NIH developed PROMISE surveys, if you're familiar with those. And if you're not, it's worth taking a look at. They're validated patient-reported outcome measures. They're validated surveys that let us know how we can assess a patient and get scores back so we can see how they're doing. So you combine your vital signs with your assessments, and we begin to get a picture of who may not be doing so well, who may not be controlled, so to speak. A little bit about the PROMISE surveys, I won't go into detail, but they can be anything from mood to pain to sleep to comfort, taking care of your own condition. So those are the types of surveys that we can offer through this general monitoring plan. Again, the notifications would come back the same way to the dashboard, and then we're able to customize some of the messages. For example, you may say, I want you to call your PCP, or you may say, I want you to call this dedicated line who's trying to triage some of these particular issues. So a little bit of customization on the side of the facility also. And so this is the last slide that I had to share. I mean, in summary, again, I just need to follow back up and thank all of you who are on the healthcare provider side, the public health side, and whether you're touching patients directly or supporting this from an administrative or an IT role, you know, the most heartfelt thank you I can give to everybody who is working on this right now. So I'm going to stop here and see if there's any questions that you'd like to take.